Thank you for joining us today on Health Matters. I'm Dr. Mark Castellaw. Our program today is about diabetes, particularly type 2 diabetes. We're fortunate to have two guests that are patients that have diabetes that are willing to share their stories with us, Walter Morris and Larry Robertson. Thank you guys for being here.
Thank you for having me.
Now, Walter, you were diagnosed with diabetes in the past and then sort of fell off the wagon, so to speak, and went to Crystal Hamburgers a lot, but you've sort of gotten back on the path of watching your diet and taking your medicine. So what's your journey been with diabetes?
Well, it's been real difficult for a while, but through medicine and exercising and also diet, you can relieve the problem with diabetes if you work at it.
Now, like you said, it takes work. I mean, diabetes requires effort not only on the doctor's part to prescribe the medicine, but also for patients to take their medicine properly and to exercise and watch their diet. Well, what about your diet today, Walter? You're not doing Crystal Hamburgers anymore. What else are you doing?
If it's green, you can eat it. Just stay away from the carbohydrates, the potatoes, the bread, and just stay on your diet. Check your blood sugar every morning, and you should be all right. And exercise. You can't have one without the other. You must exercise along with your diet.
Well, great advice. Now, Larry, you are diabetic and you were on medicines for a while, but your diabetes progressed and you had to take shots. Tell us about that.
Yeah, you're correct. The shots are not as troublesome as most people would think, sticking a needle in your body. The main thing is just trying to find a spot, that's appropriate to do. But I really didn't I had some anxiety about taking the shots at first, but once the nurses told me how to do it, and it was really simple, and I've become so used to it, it's just normal like breathing. I mean, it's very...
Well, what are some of the things you've done, Larry, to control your blood sugar? Like Walter was talking about diet and exercise. What are some things that you're doing?
Pretty much the same thing, diet, controlling diet, exercise. I've always liked to exercise, and I've probably increased my exercise routine since I was discovered to have diabetes. But I think it's really a matter of disciplining yourself to eat the right foods and to basically exercise properly.
Now, you mentioned this, Walter, already, but how important it is to monitor your blood sugar regularly, because that sort of gives you feedback on if you're doing the right thing or you're not.
Right. If you don't monitor your blood sugar every morning, you don't know where you are. If you don't know where you are, you're not going to know where you're going, and it will just continue to go up. If you don't know in the morning that it's 150 and you have lunch, we're getting off the scale. So you have to do your blood sugar in the morning. I do mine every morning, and then sometimes in the evening, but you have to do that blood sugar to find out where you are. Now,
Larry, with you being on insulin, that's also very important on how you monitor your blood sugar as well.
Correct. Like Walter's analogy, check it every morning, and realizing what I ate the night before, for dinner. And sometimes I'll know whether it's going to be elevated or not based on what I ate, but it's very important to check your blood sugar at least once a day, and I usually check it first thing in the morning.
Now, it's important to tell our viewers that y'all have both been diagnosed with diabetes, but the key thing is both of you are doing real well, correct?
Yeah, I think my A1C has been lowered significantly since over the period of the years, specifically since I started taking insulin.
Walter?
This morning it was 109.
109, I like that.
And you just have to stay on top of it. You just really do.
It takes work.
It does.
Well, thank you guys for being here. This is Dr. Mark Castellaw with Health Matters. Continue to stay tuned because we're going to have more information about diabetes.